More seniors have come forward or have been coming forward for coronavirus vaccinations. Despite steady progress, though, some seniors are still concerned. Associate Professor David Sim from the National Heart Centre joins us to debunk some of their concerns. Professor Sim, let's first take a listen to two of your patients, one who'd suffered a heart attack and the other a volunteer who's been encouraging other seniors to get vaccinated.
I hear a lot of people telling me, pain here, pain there, people fainting, so on. So during my routine checkups in the heart center with Dr. David Sim, we say, don't worry, we are doing all the vaccination for our patients in the heart center in SGH. That gave me confidence.
They are worried that maybe they inject already, they can just pass away, and they already got side effect because they hear here and there people talking and they believe them.
Professor Sim, we've just heard some of the concerns raised there. Where do these fears come from, and are they valid?
Most of this fear come from the misinformation that patients may have heard or have read from the social media or from people around them. Of course, most of this information are not accurate. Things like the vaccination is full of complication and not effective. But the best way to address all this fear of our patient is not to confront their fear, but to listen to them and give them accurate information so that they can be encouraged to go for early vaccination.
Professor Sim, this misinformation aside, why is it so important for people with underlying heart conditions to get vaccinated?
That's because patients with underlying heart problem or any chronic illness, they have a higher chance of getting a very serious infection with COVID-19, higher chance of ending up in ICU or even death. But with vaccination, we know that it is effective in prevention of severe disease, thereby reducing the risk of ICU stay and death. And it's important to preserve this because if not, if we have too many sick patients, the ICU bed may not be enough and the whole healthcare system may be stretched.
Yeah, Professor, both your patients that we heard from just then, they've both since had their jabs. Let's listen to what they have to say and how they've gotten on.
The first jab, there was not much effect on my arm. The second jab, it gave me a bit of swelling, but nothing that serious.
It's just like the hand a bit pain for a few hours, then everything go back to normal. Then the second jab, I got nothing side effect, no fever, no flu, no pain at all.
Professor Sim, side effects aren't unusual, after inoculation, but are they any different for heart patients?
No, the side effects for the heart patient are the same. They are usually very mild and self-limiting and will resolve after a few days. This includes pain over injection site, a bit of low-grade fever, and muscle ache, which is actually the body immune response towards the vaccine.
Yeah, Professor, we also spoke with a 73-year-old senior who's previously had a heart attack and bypass surgery.
My children who are staying overseas encourage us also a lot to quickly get it vaccinated to get protection. So much so, even my father-in-law, who is 92, he was vaccinated together at the same time with us. Of course, one of the objects also to be able to quickly travel overseas to meet my family once the travel restrictions are lifted.
Many of us, Professor Sim, have heard stories about family support being important, encouraging family members to get vaccinated. How important is it for family support for the elderly who might still be worried about getting this jab?
So the best thing for the family member to do is to provide the correct information for the elderly family members. There's still a few elderly patients who had a misconception that by isolating themselves at home, they will not get an infection, but they don't realize that they can still get an infection for a household member who actually had to get out of the house. So I think it is very important to stress this to the elderly patient to get vaccinated to prevent severe disease.
And it may not just be the elderly generation that may be concerned. What would you say then to younger people who might be concerned about their elderly family members getting a shot?
So for the younger people caring for the elderly folks at home, I would say that the best thing they can do is to encourage early vaccination for the elderly parents or family members. Vaccination not only protect the physical well-being of the elderly folks, but also the emotional well-being. Only by having a high vaccination rate, then can we reopen safely and encourage more social interaction, which is very important for the emotional well-being of the elderly.
All right, well, thank you so much for sharing your thoughts with us this evening. Associate Professor David Sim from the National Heart Centre, Singapore.